I'm going to be talking a little bit about types of breast implants. Um, Breast implants come as saline-filled implants or silicone-filled implants. But all the implants that we use come with a silicone shell. So you're getting silicone at some ways if you're getting any breast implant surgery with us. The saline breast implants are pretty good. They help provide volume to the breast, but they don't tend to give as nice a shape or feel as natural as silicone breast implants. The main benefit for a saline breast implant is that if they were to rupture, then your body would just absorb the saline and you would see that the implant was deflated, and you know you need to have it removed or exchanged. And so they're useful because they don't require breast surveillance. Silicone implants, it's recommended that the FDA monitors for rupture with an MRI 3 years after they're put in and every 2 years thereafter. And this for cosmetic surgery often comes with an out-of-pocket additional cost. So here's an example of a saline implant that's uninflated, and it's hard to keep these in the office because if we have them open to air, the saline will evaporate and it just won't look good. I do have an example of the Ideal implant, which is a newer type of implant, and it is a saline-filled implant, but they call it a structured implant because it has internal baffling that helps provide and give it some additional structure, more so than the regular saline implants that the main manufacturers produce. This implant is made by a company that is run by plastic surgeons, and it has an excellent warranty as well, just like the other implants. And I think for patients that want to have significant cosmetic improvement but want a saline-filled implant, this is an excellent option for them. But the implants that look and feel the most real tend to be the silicone-filled implants. And they come in various different styles and sizes and levels of cohesivity and firmness. And so this is an example of the classic style smooth round silicone breast implant. And for a patient having a standard breast augmentation that has a decent amount of breast tissue and has a nice shape, this tends to give a very nice result because it feels very nice and helps give a nice natural form to the breast. And in the breast, it's meant to still have a little bit of a sort of a teardrop shape that when no matter what position it's in, so that it gives a natural shape to the breast. They've come out with some implants that are similar to these but have more silicone in them and are more firm and have a little more cohesivity to them, so they give a little more form and shape to the breast as a round implant. And here's an example of one that's a little bit more firm than the classic implant. And they do have another one that's a little bit even more firm than this. It's more like the form-stable implants that I'll be talking about next. So the form-stable implants that are the shaped implants come in the most level of firmness and cohesivity. And they can come as shaped implants, and they've also produced some that are round implants. These all come as textured implants, and the benefit to these implants is they give the most stable form to the breast. And they're sometimes useful when patients have some deformity of the breast or they're having breast reconstruction where you really want to hold the form to the breast. One of the downsides of these implants, however, is if they rotate in the breast, you have to move it back into place, and that usually requires surgery. They also all come as textured implants, which is good in one sense because that holds it where you put it. It holds it where you want it to be and also prevents it from rotating. But one of the downsides is that there is a rare tumor that seems to be somehow associated to these textured implants. It's a very rare tumor, and it's something they discovered within the past 10 years, and they're doing lots of studies to try and understand it more, see if it's related to certain types of implants and certain types of people the most. But that being said, even the fact that this tumor is a little bit rare, a lot of people are averse to putting these types of implants in. Now, I still think these are pretty good implants and I still use them, but if all things are equal, we usually tend to choose a non-textured implant in those circumstances. That being said, these implants are very powerful. They're good at holding the volume of the breast that you want to add volume to the lower portion of the breast, which helps give it a natural shape and helps give it some natural form. And therefore, sometimes it's one of the best options. So we have a lot of options in choosing breast implants. Beyond this, they come in different sizes, come in different levels of projection, and so when you come in for your consultation, we'll discuss what's involved with the different types of implants, the benefits and drawbacks, and determine what type of implant would be best for you.